Hey, I'm Luke Schellenberger. I'm an ENT doc. I'm also board certified in sleep medicine, and so I deal with patients pretty frequently who have sleep problems. One of the most common issues that I face in patients who have sleep issues is sleep apnea. So sleep apnea is when a patient stops breathing at night, and there's two types of sleep apnea. There is obstructive sleep apnea, and we'll talk a lot about that, but I want to briefly talk about central sleep apnea. Central sleep apnea is when basically our body doesn't even try to breathe. And so an apnea is a 10-second pause in breathing, and a central sleep apnea is when basically our lungs don't try to breathe, we don't try to inhale at all. There's neurologic causes of that, and sometimes cardiovascular issues can lead to central sleep apneas. I really, from a surgical standpoint and an ENT standpoint, if somebody has central sleep apnea and we diagnose that, we say, look, you need to go see a sleep neurologist or a pulmonologist, and so who deals with sleep issues. So I don't deal with central sleep apnea very much, but only to say that obstructive sleep apnea, which is what most people think of when we think of sleep apnea, is most of what I deal with. So obstructive sleep apnea, what that is when we are attempting to breathe, but obstruction occurs at the back of the tongue, at the back of the throat, back of the palate, that doesn't allow airflow to get from the outside down to the lungs. And so when we're dealing with sleep apnea, we've really got to find out how bad it is. That's really important. It's imagine somebody said, I think I have high blood pressure. Well, do you or do you not? They always have to check your blood pressure to say, yes, you do. And there's big differences between mild high blood pressure, moderate and severe high blood pressure. And the same thing goes with sleep apnea. If we really kind of compare high blood pressure or hypertension and sleep apnea, they have a lot of the same sort of effects on patients from an overall health standpoint. Obviously, they're not nearly the same, but as far as actually what's going on in your body, but patients who have, moderate or severe high blood pressure and leave it untreated, it's a lot like patients who have moderate or severe sleep apnea and leave it untreated. Left untreated for years and years can certainly put a lot of stress on our heart and on our lungs, give us a higher risk for heart attacks and strokes and other medical problems. And so what I'm getting at is that, if someone has sleep apnea or they think they have sleep apnea, it's really important to get a study done to find out if they do and how bad it is. Because if someone has really mild sleep apnea, there's big differences on the effects on your heart and on your lungs as compared to moderate and severe. And so I'm going to do another video here in a little bit about what actually this thing does and how it helps us in that diagnostic process. Okay, so we'll talk about that soon.